Where you feel better?
That's right.
How you were feeling this, you were sick, right? Or no?
Oh,
Sick?
out there.
I appreciate you
Right.
asking. Well,
That's good. Is that with their attention?
oh, no, I cut the,
3,000?
yeah. Oh, I was waiting for sure.
Oh, okay. I thought
Calling Newcastle City Council special meeting to order. It's Wednesday, April 26, 2023. Please rise for the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to thank everybody for coming. We're having this meeting to kind of do some recapping and get some concerns that were brought to us clarified, I guess, which we want to get from you guys. So kind of to recap the services that have been provided. Back in June of 2021, I re-listened to our meeting that day, and Chris, you came up and introduced yourself and told us about the ambulance service and what your plans were. In the taping, you talked about that it was going to be a 24-hour EMS service, that two crew members will live at the base 24 hours, and that there's an on-call staff, all at a paramedic level, which is the highest in Wyoming. Is that correct?
Correct.
Okay. And so you're going to have that highest level here in Newcastle every day, 24 hours a day. Also in the taping, you talked about having the ambulance service run the same as Roger Husky has it ran, as well as possibly being better because of the higher level care, correct?
Mm-hmm.
Okay. So with that, a lot of things have been coming to us as council members because, you know, we give you guys a subsidize of $100,000 and you're asking for $10,000 more from the city of Newcastle. We feel, I don't want to say we, I feel like Newcastle's on the back burner. And the reason I feel that way is because we used to have 20 to 30 minute waits for transfers. Now it's over 2 hours, maybe even up to 24 hours. We also have more life flights than we do transfers, which is very cost to our constituents, patients. We have only one ambulance that's staffed, and you say that there would be an on-call staff. We've had multiple, lately there's been multiple calls, like one right back after the other. And we don't have an ambulance to service that. So I'm not sure where that is at. I mean, are we not having a second crew here?
So, I guess to back up a little bit, should I go to the mic?
You're fine there.
Okay.
Oh,
You want me to go to the mic?
okay.
Mic doesn't work.
Oh.
No?
No.
I'll just speak loud if you can't hear me or can't hear me in the back, let me know. So I guess to back up a little bit, I can say right now, I don't know of any times where you've had to wait like 24 hours for a transfer, or I don't remember what you said the other stat was. At our last meeting that we were here with you guys, we said we need that 45 minutes to an hour to get a crew from either Wright or Gillette over here to back up or backfill the city and the county before we can send an ambulance out of the county, like on a interfacility transfer.
So we have an on-call crew, and the staff that's working, and then an on-call, why do we have to wait?
Because we do not have the ability to staff an on-call crew due to staff not being available within really all of Weston County. Like I said at that February meeting, we have tried since the day we started here to recruit enough EMS providers to not only staff our on-duty truck that's at the base 24 hours a day, but also then to provide backup coverage, so people that we can call in when there's another call. Out of 6 EMT classes that we've put on since July of 21 when we have taken over, there's been 2 people from all of Weston County that have signed up to take those classes. Despite advertising and recruitment efforts, there just does not seem to be an interest in this community or the county for people to start a career in EMS.
How are you advertising? Because I haven't seen it I haven't seen any advertising.
So our main advertisement is social media. That's the widest, reach to get to people. We share it on websites. We share it on, of course, those social media sites. And there are even different mechanisms to advertise. I can't confirm that it's been in the newspaper here, or I know we haven't asked the city or the county to say post it on their websites. But generally our advertising is done in the electronic format.
So what is those websites? Is it a Campbell County website?
Yeah, it would be primarily the Campbell County Health EMS website, Facebook page, Twitter, the normal social media sites.
So if it's Campbell County and people live in Weston County and Newcastle, I don't think they would look at Campbell County.
So the way that we target areas for social media is using keyword searches. We pay to have keyword searches for it to bring up our ad. So if someone types in EMS and they live within a certain area that we have geo-fenced, so 200 miles within Gillette, they type in EMS, we pay for that advertisement to pop up for an EMT class or even job opportunities that we have within our system.
Have you considered advertising in our paper?
Again, I can't confirm. I honestly don't know if we specifically run an ad in our paper. I would have to ask our marketing department.
Well, I know you don't, because I researched, and since December 2021, there's not been anything from Campbell County in the paper. So, I guess I'm just really concerned about the fact that we don't have a on-call crew to back us up. Especially, like I said, I'm going to keep referring to the quote you said is you're going to give us the same as Roger, if not better, because of the level. And I don't feel like we're getting that in our community, and there's a lot of others who are feeling that they're not getting it in this community. How would you like to address that to our community?
Well, I would say we are providing the backup crew. It's an hour away. We don't have the citizens who work for us in this community that can be here in 10, 15 minutes. Again, we are actively recruiting both through our job advertisements as well as our EMT classes to build the numbers up of people who live in this community. To do that, there just seems to be little to no interest.
Can you tell me why there's an increase in life flight versus transfers?
Part of that could be acuity of patients, so how sick or injured those patients are. We actually have some statistics from the hospital. They have transferred out since January 1st.
I have March and February.
March and February, they have transferred out of this hospital 17 patients. Of those, the physicians made the decision that the patient was either sick enough or injured enough that they needed to go by life flight, so that could be a helicopter or that could be a fixed wing. And so on those calls, they're not asking us to do it. They're saying this person's sick or injured enough, they need to go by helicopter or airplane to whatever facility they're being transferred to.
So who decides that?
The physician.
Okay. Can you tell me about your safety matrix?
What's that?
Can you tell me about your safety matrix?
So we have what we call it the transfer matrix. So it essentially looks at three criteria to help us decide if a transfer is safe to do. So it looks at our staffing in the system, which obviously Newcastle is part of. It looks at weather, road conditions, things like that. And then it also looks at the acuity of the patient. And so it's an Excel spreadsheet. It has weighted scores as we put in the information. It'll essentially color code it, whether it's green, yellow, or red. And so when we get those, if it's green, there's really nothing to consider, and so we can take that transfer. If it's yellow, there's safety things that we need to mitigate. If it's red, unless it's like a road closure, like we can't get to Rapid City because the road is closed. If it's red, that means there's several things we got to try to mitigate before we can accept that transfer.
And who does that? Or who does the grading on that?
So at this base, it would be whoever receives the phone call at this base, they would assess it for this area. Because obviously, weather, staffing, roads can be different here than they would be in the rest of our system.
All right, now I'm not saying that the staff that works here does this, because from what, I'm fortunate enough that I haven't had to have an ambulance come and get me. But I know those who have say the staff is amazing. So I want to make sure that everybody's aware that this is not about the people that are actually working on the ambulance right now. But, so the person that fills this out could be like, man, I really don't want to do a transfer, so they're going to score it high. Is that a possibility?
I mean, yeah, it's a possibility, but it's immediately reviewed by the leadership team. And if that employee essentially were to fill it out or falsify something in it, they would face discipline action. Our culture is not to not take something because we don't want to do something.
So was this matrix, I have a copy of it. Was this made for Newcastle, Western County?
It was made for our entire service. We didn't like specifically develop once we started in Newcastle. We had it in place, and so we use it at every one of our base locations when these interfacility transfer requests come in.
Okay, so us being in Newcastle, Aurora area, we don't have the things that Gillette has. So when we have transfers or things, it's because we can't facilitate it here. So what is something we can do to change that?
Are you asking from the hospital standpoint or the EMS standpoint? Because
The
obviously,
EMS standpoint, because I have, I talked with one out of a couple different life flights, and let's say from 2017 to 11-19, there was only 4 life flights. And then from 10-21 to 3 of 2023, with just this one air company, there was 12. That's a huge difference between our former ambulance service and yours.
and I said it could be due to patient's acuity. It could be we just had more sick or injured people come to the hospital during that time period. It could be that the hospital decided this patient needed to be transferred faster by air than it could be ground. And certainly it can relate to our safety matrix and the need to get a crew from Gillette or Wright over here. If the physician decides we can't wait an hour for that patient to leave, then
Okay, because I pulled all the calls for service since you guys have taken over versus what the former ambulance has, and it's not a huge difference in how many calls for service.
right, it's not the number, it's the acuity or the severity of the call.
Did you have a question?
Yeah. It's, Don Taylor, is time also a factor in that consideration when a transfer happens? For example, if you say we're not going to get there for 2 hours, they say, okay, we're going to take it by flight, not on stability or condition, but time. Is time a consideration in that factor?
Yes.
So if we can't get a second ambulance in a proper amount of time, stability has nothing to do with it. conditions have nothing to do with it, it's simply a time decision. That's
Well, but
what we need them out of here.
those really go hand in hand because the stability of the patient dictates how fast they need to go somewhere. So a really sick or injured patient need to not be able to wait. Someone who's stable but just needs a higher level of care that can't be provided at Weston County, they may be able to say, which they have, okay, we can wait that hour, we can wait that 2 hours until you have an ambulance available to do it.
But who makes that call on the time? Is it back to the doctor or
The
is it?
physician. The physician, basically, whether it's us or flight, says your ETA is an hour or two, you can't wait that long, you need to look at another method.
What you're saying is that it takes 3 hours, because if this patient needed to get to Rapid City in an hour and 15 minutes, we can do that from an ambulance. If your ambulance could show up to the hospital within minutes. But now, he has to wait for the hour and a half for you to get there, then another hour and 15 or 20 minutes for him to get him to the hospital in Rapid City. That's what we're saying here. It is not, like the commissioner said, this is a matter of your time, not anybody else's problem. It's yours. And what it's costing the patient is thousands of dollars, because there isn't a medical plan in the world that covers 100% of a life flight.
I agree.
And I can guarantee you, there are thousands, and you know it.
And so are our transfers are thousands as well.
Okay, so let's get it straight, like the commissioner said. This is a time problem, and it's yours, and you need to stand up to it.
I'm not trying to deflect any of that responsibility. I want you to know that it is a decision of a physician, and they take into consideration our time that we need to backfill into that transport method decision. They do, absolutely.
So from my understanding, you have, if we need a backup, Gillette sends one to Wright, Wright sends one to us.
Generally go back forward.
Yeah, we
Okay.
send one from right up here.
Okay,
That's the
so-
fastest.
Sending the one from Wright to us, ours stays in town until they get here?
Usually.
Yeah, sorry, I was thinking too far ahead, yes.
Can I speak?
Yes.
So typically, hello, my name's Brad, I'm a shift supervisor for the ambulance. Typically what would happen, if we had a transfer request, our crew would probably have already picked them up from the 911 call that they originated from, as per their contract. They would drop them off at the hospital. They would then call and say, hey guys, we've got something that's sick, it's probably gonna be transferred out, heads up. So that would get the things moving in Gillette and Wright to be prepared. We try to look at this as a system, not a Newcastle ambulance or a Wright ambulance. So what would happen then is they would say, hey, we got a transfer request, send Wright. Wright's already aware of it, they're starting to boogie. The crew goes to the patient's bedside. When they get about halfway here, because we have to have an ambulance to cover 911 calls, right? So when they get about halfway here, they're able to respond to your 911s, then that crew can leave from bedside of the hospital. And that's the way it's supposed to work in this system.
So geographically, we're spread out, right? And then having worked for Newcastle Ambulance Service in the past, I can say that we're not getting the same. We're getting paramedics now, right? But we're not getting the same level of service. I mean, the response times were much better when Roger was running the ambulance.
And can I say one thing? I think that's fair to say on interfacility transfers. It's not fair to say on 911 calls. Our crews are in the station. Our shoot times are less than 2 minutes versus what they were when crews had to respond from home into the base. So that's fair.
Okay,
That's
so-
partly fair.
So talking about transfers specifically, I mean, my family was negatively impacted recently because my father needed to be transported to Rapid City. He had something really significant going on with him, and he had to wait in the emergency room for, over 2 hours before the ambulance arrived to transport him to Rapid. So, I mean, we asked, can we just take him, but he was already on a morphine drip, and they were like, no, we can't release him for you just to take him. So we had to wait, and unfortunately, because of the nature of the condition that he had, I mean, he was negatively impacted by that long wait. So, I mean, it's unfortunate, you know, you guys talk about advertising, right? We have, you know, Facebook pages that are specific for our town. You guys maybe just have your marketing people talk to us a little bit, and then maybe we can develop some kind of a plan to get the word out to people so that maybe we can drum up a little bit of support for the ambulance service and try to get some people that are willing to be EMTs and do the work. But right now, as it stands, I think that, you know, that we're not getting the same level of service that we were when it was under Rogers' control. So,
Mr. Cost, I'm sorry.
that's all right.
Mr. Owens, I was looking at you at the same time. So, I appreciate what you say, and I would agree with you wholeheartedly. When it comes to that backup ambulance crew, we have not provided that same level of coverage. In the meeting in February, I said our biggest vulnerability over here is staffing. We thought we were coming into 20 people on the roster. It ended up only being 5, and then it ended up going down to 4 from there. And so I feel like we've been behind since day one, and we have tried, again, through the methods I talked about, to bolster our roster here and just have had little to no interest. That's not deflecting the blame, that's just saying we haven't found the right way to recruit those individuals in this community into our service. What I think I'm hearing from you is this needs to be a partnership, and I would wholeheartedly agree with you. Our own efforts haven't worked, and I would love to work collaboratively with the county, the city, the school district, whatever other resources are available to get those numbers back to where they need to be. Ideally, we would have 20-ish people that live in this community that are very close by, that are on our rosters, that can be put on that rotation of on-call and can get us actual on-call crews here. The methods we're using now, they're a stopgap, because we don't want to say we can only put one ambulance in Newcastle, and when it's gone, and that's it. We have our contractual obligations with both the city and the county to provide that 911 level of coverage. We know that inter-facility transfers are an important part of that, because this hospital, just like our hospital in Gillette and the hospital in Sheridan, can't take care of everybody at all levels. So we recognize that those inter-facility transfers are one of our roles to fulfill. What we've asked for, and I feel honestly we've gotten very little of, is some grace in saying that because of our current situation, we can't immediately put a backup crew in place. We can provide a backup crew, we need 45 minutes. And in my experience in healthcare, when someone presents to the emergency department, it's much longer than 45 minutes before that patient is ready to be transferred somewhere else. It's usually an hour to 2, maybe even 2.5. Our average length of stay in our emergency department, in Gillette, I can't speak for the one here, is 192 minutes. To Mr. McKee's point, most physicians, when a patient walks in, they know immediately if they're too sick or too injured to stay here. If we got that phone call that said, we've got a patient we highly suspect we're transferring out of here, we would have an ambulance parked here waiting to go when that patient was actually ready an hour and a half, 2 hours later to be billed. But what we're getting is, patient needs to go and they need to go now. And all we're asking for is give us an early heads up so we can make that happen.
Have you talked to the hospital regarding that?
We've had several, we meet with them quarterly, and this exact issue has come up about transfers. And we have talked our way through it. And it's been mutual, it's been collaborative, we all understand each other's position. But that's one thing we just have not gotten, is that early heads up of, you guys know when you're gonna transfer somebody, get us coming as soon as possible. Even if we get here and it's like, never mind, they're actually not as bad as we thought, we'd rather go home than miss out on the transfer like that.
What levels of certifications do you guys require?
So we will hire anybody from an EMT all the way up to that paramedic level.
Even nurses in some cases.
Yeah, and actually we hire nurses as well.
We had a question in the back.
Yeah. So I'm Angie, first,
Yes, ma'am.
we've met. One question I do have, I do think that we are working better on notifying you guys right away that we need these transfers. However, we did bring up that driver's position, and I gave you 4 specific people to help with these transfers. have any of them been contacted? Are they hired? Where are we at with that? Because I really think that would help you, that we've actually given you the names. I want to volunteer to do this. Also, as far as ER wait times, we're comparing apples to oranges. I mean, we're in Newcastle, we don't have everything that Sheridan or Gillette has. Our ER wait times were significantly lower back in the day, and we're waiting. So I guess my question about the drivers is
Yeah.
one thing I'm
I would defer to Sean on
So
that.
the driver position is something that we have discussed as a potential to look at having a driver-only position, as having, people that would come in, and Roger used to utilize this position, but then it would still utilize having to have an attendant with that position. So we would still have to find a staff to go with it. So again, we can hire a driver, but we still need another staff to go with it. We don't have that ability.
Would it be possible, can a nurse go on these trips? If you guys got a driver and the nurse can
Yes.
get in the back of that thing and go?
Sure.
They have to be our employee.
they have to be an employee of them.
They can't be the hospital?
That's
Oh.
not correct then, right?
I didn't know.
Statement's not
Thank you.
correct.
No, it is correct for us.
Yes.
So how can that be then in several calls here just recently, that you've arrived on site? And I've made notes in here just recently that you've had one person at times that's been at the bay, and one incident where you had a personnel problem. The ambulance arrived with only one person on the bus, and they utilized drivers from the fire department to drive your ambulance. So that statement is not correct.
That's
I was
emergency.
referring to the nurse statement, I was not referring to the driver's statement. We can't have somebody who's not our employee
Gotcha.
taking care of a patient in the back of our ambulance.
Thank you.
Now, on the driver's side of things, our insurance company will cover anybody that we say, can you drive the ambulance for us in an emergent situation? The inter-facility transfers don't apply there. They will not allow us to routinely use a driver who's not an employee, who's not covered by our insurance, to perform these types of transfers. But they say, if you show up and it's, a crazy situation, and for some reason you need both of your people in the back, we will cover a police officer, a firefighter, things like that. But they won't cover it on a day-to-day or regular basis for a non-emergency situation like a transfer.
And I know Roger used to do that frequently as well.
Right.
Yeah.
He told us that he did that all the time.
Yeah.
We have
So,
a
I have a
question.
so I have a question. So you could use a driver on a transfer instead of tying up two of your EMTs. That way, that would leave one in town. And then you would just have to find somebody else to run with them.
Correct, but we still
But you don't have any drivers on your rosters yet.
Correct, but we still don't have other people to run with them in town.
Okay, so if you had two drivers, one could go with the EMT on the transfer and one could be here in town with the EMT here, that would staff two ambulances, correct?
If the driver was our employee, yes.
Okay, but have you chose to look at that option? You struggle getting EMTs, but have you tried to find drivers? Because if you've got two EMTs staffed here all the time, and you get two drivers,
Right.
I mean, now you have four people. You have two ambulances that can leave at any point in time.
We do still run into the issue though, sorry, I'm Shane, I'm the operations supervisor. We do run into the issue too of providing that paramedic level coverage. And so if we did have two drivers available to us, yes, we do keep a paramedic on staff. Usually it's only one, occasionally that there is more than one ALS qualified personnel on staff. But if we had two drivers, and say the paramedic has to go take this critically ill patient on a transfer, then all we have left at the station is an EMT basic, which is still, we're not meeting the terms of our agreement to provide ALS coverage in Newcastle.
So you keep referring to agreement. We don't have one with you.
So we have, the agreement with the county is mentions City of Newcastle and Weston County, and says that we have to provide an ambulance for emergent response at the ALSO. Do we have that copy?
It's with Western County.
So you say it's with the county commissioners that you have?
Correct, but it is a copy and it says to provide services to the city of Newcastle and Weston County for the cost of $15,000.
So it says Newcastle Ambulance Service will provide various services to the residents of Weston County during the fiscal year commencing July 1st, 2022 and ending in June 30th, 2023.
Below that's Article A.
Article A, ambulance will provide emergency ambulance service to the residents of Newcastle and surrounding area. County shall pay ambulance the sum of in return for the services aforementioned. And said sum may be paid in 4 or more installments depending upon the availability of funds when requested.
So when
So
we
that's our
refer
agreement,
to,
that's what we were referring to. We are under contract.
there's not a separate one between the city and then also the county.
We are, and I wanted to reference a couple things. When we talk about adding extra staffing, I'm very aware that adding extra staffing is, we could add extra staff. We can put on more, we can get extra EMTs on. Currently, our February finances, I want to review those, because when we were here in January, our finances were a lot different. We talked about losing money in only 1 month, and February was that month. In February for us, we were $9,000 under projected revenue due to the payer mix that we received. So our revenue for February was only $39,023. Our operating expenses was $78,469. We were over budget by $6,000, which was primarily related only to staffing costs already. And that's it. We were not over budget at all on non-staffing related costs.
I'm sorry, that 39,000 and that 70,000, what was that again?
So our net service revenue was $39,023. Our operating expenses were $78,469. Yep, I have packets for everybody if they'd like. So we lost $39,000 in February. Currently, year to date, we are at a $34,000 loss in Newcastle alone.
And that includes all of the things that you have billed the individual
Correct.
customer for their insurance.
Correct. So right now, our net service revenue is $631,918. We're actually $213,000 above our projected revenue over here. So we're over our revenue. However, our operating expenses, primarily due to staffing costs alone, are $59,000 over budget. I don't have any budget overage in anything related to non-staffing related costs. And I'd be happy to do a printout of our full insights for you guys. So currently we are at a $34,701 loss in Newcastle.
So, just, having worked on the ambulance service and everything, I mean, we were doing okay without having a paramedic on staff, right? We were running it with basics and intermediates at the time.
Sure.
So I don't know what they changed the way that people are rated now.
It's pretty basically the same now.
Basically. So, I mean, just speaking for myself, having a basic there and being able to run the second ambulance is more preferable to me personally, to see that other ambulance is engaged, able to operate and make a transfer or, make an emergency call rather than not having that, in backup. So I mean, if the contract was to be reworded, I mean, it's great having a paramedic, but not being able to staff an ambulance and then having to wait 45 minutes for a backup ambulance to come. I mean, it seems like a no-brainer to me. I'd rather have the immediate response.
I think you're referring to the 911, I think you want to make sure.
Yeah, I keep flip-flopping back and forth, but yeah, sorry about that.
No, you're fine.
I have a question. In your 2022 breakdown of call types, is this, you say you have 417 transfers?
Transport.
Is that including the 911 call?
Yeah. That's how many times a patient ends up in our ambulance and we take them to this hospital or from this hospital somewhere else.
You were answering the question for me, sir, so, remember.
Yeah. So on the 911, I mean, I think broadly speaking, absolutely, having an ambulance versus no ambulance, whatever you can put on that ambulance to get a patient here would be ideal. But we aren't what we call scratching our 911 calls, meaning we're not responding to 911 calls because of how we set up our system. We guarantee we will always have an ambulance available for the 911s. What we're turning down, or more appropriately, what we're asking for a delay on is those inter-facility transfers to move the trucks around to keep that 911 truck in place.
Just to, I might be stating honest, but I'm a little confused. You said that you're understaffed. You were gonna start with 20, you're down to, you were at 5, correct me if I'm wrong. You're understaffed, but your budget's already blown for staffing. Where was the calculation before you would have had 20? Where's the shortfall, I guess, is my question. I'm trying to understand. If you were supposed to have 20, you're understaffed now, you're over budget on your staffing. I'm confused on where the plan was to put that together to operate, function under the capacity that you were originally going to do.
Overtime's a big thing. So we end up with a lot of overtime hours, and then a lot of bumping crews over here to help cover the backup for the crews that go on transfers. So that incurs overtime. They have to come over, they hold over so those crews can go on transfer and come back. So that's a huge shuffle in the system. But that would be a huge piece of it, would be the overtime that we're paying for the staff. And we had a lot of snow events, and then we did end up with a raise from our organization for.
Yeah, I'm just trying to.
Yep.
I guess a good question. So one of the things too, I think, is staffing more with less. So asking
You're
you
into
folks,
overtime hours and
getting into that, and to your question about the EMTs, we are putting on an EMT class this fall, and I'll work with our marketing team to make sure that we get into the paper here and any other places that you guys recommend to hit folks. I know that there's a very deep roster within the fire department. We can try to hit you guys. I know you probably don't have a lot of interest in it, but we'll try again. But we can definitely push that out to the EMT level, and hopefully that will get us some of that overtime as well.
Mr. Owens, if you'd like to come back.
I mean, I care about this community and I want to see the citizens served. So I'm thinking about it a little bit.
Just out of curiosity, Pam, talking about the lifelines, the 12 that you were talking about, are those initiated by, are they the ones that you're saying are initiated by the ambulance or all total? Because I can initiate lifeline. If I get a 911 and I have an accident, traumatic injury, I don't have to wait for the ambulance. I can call them. The deputies en route can tell me, get lifeline. So I didn't know if that was all of them. I mean, in the hospital, of course,
This was not all of them. This was just only one of the flights that were able to get back to me before today, and they were completed flights. Those just where they picked up and flew to either Rapid or Casper, Denver, or.
And those were initiated by the ambulance, or did the hospital initiate some of those?
That I do not know.
Or me, or
if I may,
deputies.
so with the 911 stuff, we do have the opportunity, anyone can initiate a life flight request, and Daryl step in and all from the Air Methods side. But when you talk about once they get to that hospital, and I hand the patient over to the physician, they then become their decision to decide if they want. So let's say I had a helicopter coming. For whatever reason, I get to the hospital, I hand them off. The doctor says, hey, I don't think they need a helicopter. They make that decision, or vice versa. You should have called a helicopter, I'm gonna call one now. So that would be the difference of the 911 versus in a facility.
And if you don't mind, I can address a few things. First of all, I'm going to stand up here so I can see everybody here. So, my name is Daryl Crown. I'm the account executive for Black Hills Lifeline. So I'm one of the 2 managers for the program. So my job is to come out and address concerns, talk to agencies, and so forth. So a couple things I just want to address real quick is cost of flight. We have an extensive in-network agreement with insurance companies across the country. I can provide that to you. I'm actually in the process of updating that list so you can see who we're in network with. For instance, Blue Cross and Blue Shield, Wyoming, we're in network with. So when you talk cost of flight, it's very variable, okay? What is the average cost? I can't tell you, okay? Because there is no real true average of cost, because when you talk about the uninsured versus the insured and in a network, what generally, when we're in network with them, the only cost to the patient is going to be what their average out-of-pocket is, or their copays or deductibles, right? We all know what copays and deductibles cost us. We can't control that. So it could be anywhere as low as $200 to a couple $1,000, just throwing numbers out there without really knowing. So those are the things we can't control. But with going in network, as Air Methods is pushed, that has our average out-of-pocket is very low, okay? What that is, I don't know. But I can tell you from the 6 years I've been with the program, I have personally been involved in 4 patient events where they've received a high bill. But out of those 4, I personally get involved with our patient advocacy team. And we work together, and I will tell you that out of those 4, all 4 resulted in a very low or zero out of pocket, okay? So we have greatly reduced what the patient pays. And if the council wants to see what that in-network is, I'll be more than happy to share that with you. Okay?
You have a question, right?
Yeah.
I had some personal experience with life flight recently with my father-in-law, who was flown from here, this hospital, to Hot Springs. He's a vet. The VA did not approve the life flight, but the doctor set up the life flight. He received a bill for $80,000 for that flight. He has very minimal, he doesn't have any income, he's on Medicaid. He had to set up payment arrangements for that. But I think the one thing is, I don't think anyone's questioning the life flight, at least I'm not, but for the city and the county, Title 25s in most cases will come back to the county, and that's the constituents' money that has to pay that bill. So whatever that cost is, let's say it's $20,000, that comes directly out of our general account. That takes away from roads, that takes away from, for whatever that is. So if it's not a necessary cost, or as opposed to an ambulance, that's a huge dip out of our, do 5 of those a year. You're talking $100,000 or $20,000, but what if it's $30,000 or $50,000? That's an astronomical cost that we by statute have to pay, so it's actually out of the constituents' coffers that comes out of. So it's a concern on some of those life flights, whether they're actually necessary based on why I asked about time. And those that are car accident, of course, that's something that may be necessary. But if it's because they want to transfer somebody because we want them out of here in an hour, or we don't have an hour, we fly them out, that's coming right out of your, anybody in Weston County or the city, it's coming right out of our pockets.
And so when we come, we can't just come, we have to be requested. So the physician at that particular moment has to find the medical necessity for the transport.
Well, it's $80,000.
That's something that
for
you and I,
97-year-old
and you and I actually need to talk about that, because there might be a way to mitigate that. I'll be honest.
We've already paid the bill.
Oh, you did? Okay.
My point is that a 97-year-old man can't pay that bill.
And that's exactly why we also have a program called CARES. Okay, what we do now, however long ago that was, I don't know.
6 months.
Okay, so what we do is we actually ask our patients to call us when they get their bill, or their MOA, or their EOB, explanation of benefits. Because we want to know what their financial ability is to pay it. Because if you are on just Medicare, can you afford to pay $80,000? No.
Well, and, you know, again, I'll just say, we did call Lifelight. I'm assuming you're that same company, Lifelight. We called, gave them all them conditions. We still ended up having to pay that bill. So, not sure what the situation is, but it's just something that's concerning in all, just when you get into Lifelight. There's necessity, and then there's, we did it because we just made the call.
And I will tell you in this open forum, right here, anybody gets a bill like that high, you reach out to me. I will give the mayor my business card. You know, Chris knows how to get a hold of me.
Well,
anytime.
I'll be happy to accept any refunds that you want. Yeah, no, I get it. The bill was $80,000, and we did pay it.
In fairness to Mr. Sorry, I interrupted.
No, you're fine. Go ahead.
In fairness to Mr. Count, it could have been Guardian, had a Gillette, totally different company. I just want to say there's several different Lifelight agencies that may have done.
Yes, ma'am.
So I have a question about that, just what he said. Should a person call you or call different Lifelights to see if their insurance is?
When you have to get somewhere, you need to get somewhere.
I understand that, but if I have a choice of saying you or you, should we know that personally if our insurance is gonna cover that?
The issue is you delay patient care. And we don't want you to delay care, so what we do.
I mean today, I just called today.
That is strictly up to you.
I'm asking, would that be a good thing to do?
That's up to you. I can't tell you if it's a good thing for you or not. I don't know. That is your determination to do. There are bills that are higher than $80,000, and there's bills lower than $80,000. So that's why I can't tell you what the average is, because I don't know what it is. Every company is different. I can tell you what Air Methods has done.
But the hospital, can you answer this? So like if the time comes and we need an air flight, can we request a certain?
The patient absolutely can. If let's say
I know that my insurance
is in network with these guys and Guardian is called, or hopefully before they're called, you can say, I want to go with Air Methods because I'm in network. But the other thing the state legislature did was
you just said.
You can ultimately say, and we'll try them first. But I mean, it all depends on where they're coming from.
Sure, I understand.
Rapid may be able to come and Casper can't because that way you're happen and stuff.
We had a question over here. Sorry. So I just wanted to say, I think Air Methods is great about working on the patient bill portion, but we have to think about the whole healthcare system. So we're overwhelming the healthcare system with these two, because somebody pays for it. Insurance pays for it. It's not coming straight out of the patient, but it comes from increased premiums. I know my dad's Lifelight, when he died, it was like $25,000 just for liftoff, no patient contact, and the insurance paid all of that. Which, if I would have known the insurance was gonna get billed, I probably would have just said not to call, because the chances were pretty low that he was gonna make it. So why have a $25,000 bill in the healthcare system? And they add up. It's not just here, it's all over the country. And so we just have to think about not just what the patient's paying today, but if we keep calling Lifelight because we can't get a transfer out. And I worked in the hospital for a long time. I just recently went to the clinic, and I know your system sounds great. It sounds great to call ahead of time, and I had a lot of times where we knew the transfer was coming, so we call early. And when it works good, it works good. You get an ambulance going, but that's where the problem was coming, is that it never works as planned, or it works for a while after we have talks, and then it just kind of slowly backs off for transfer time, so it would get longer and longer. But we just have to think about the overall cost to the healthcare system.
And you're exactly spot on. I mean, nothing in healthcare is cheap. Nothing. I mean, you go in and get a set of stitches of what, $600. I'm not trying to inflate, but it's probably true. So we know nothing's cheap. And so is that the right answer? No. Is it the best answer I can give you? Unfortunately, yes. You know, we have a lot of operating costs, both on an ambulance side, hospital side, life flight side. We all have these huge operating costs. The city even has a large operating cost, right? So unfortunately, we're in the world of, we all got to think about the almighty budget, in so to speak. But what I tell people is, and Air Methods is let's get you where you need to go. And we'll worry about the bill later. We'll get you in the CARES Act. We'll find out a way to take care of you after you get better. It's truly the way we are. And I'll tell you why. Because when I started this job 6 years ago, we did have memberships. My youngest son, ranches and farms. My other son's a police officer. I have been involved in EMS law enforcement since I was 16 years old. The last thing I want to do is come up and stand in front of you and say, with your family history, you know what, you're going to get an $80,000 bill. And you know what, I don't care. We're going to take you to court. I will personally resign from my job. With the way we do things now, I can tell you we will work with you. When it comes to scene flights, for instance, if they automatically page us and they get there and they say, nah, you're not needed, go home. We turn around, go home, nobody gets a bill. No one. It's just part of doing business. Do we cancel it? No.
It's illegal to do that.
No, we can't. No, we don't bill anybody. Not an entity, not the individual. If we arrive on scene, Medicare does allow, if there's a death, and it's with ambulances, that they can bill a fee. Generally, we will not. Okay, because why put a family through that just lost a loved one?
I mean, we didn't get the bill for this, but they never landed, they never arrived, so. And I called the insurance company and told them too that happened.
I can speak for ground ambulance, but it's illegal for me to bill a patient if we didn't transport that patient.
And that's what I would have thought.
And I thought it applied to air as well.
Yeah, as long as we don't put generally we won't bill. We will never bill a patient. An insurance company, there's some, and I can bring in somebody that can actually speak to this a lot better to you guys if you want to know. I can bring somebody in from California that's part of our department that can actually speak to a better level of it. But there is rules in Medicaid that allow us to bill if there's been a death, we've been paged. It's basically a lift fee or whatever the fee is. But that's a whole different realm. That's not my specialty. I just know about it. And if you want to know more about it, I'm more than happy to bring in somebody who can actually speak to them. Honestly.
I mean, I understand you need to get paid if you lift off. That's not the problem. It's just the overall expenses that add up.
They do.
And they do. I mean, they do bill. It happens. We've got the bill, so I know it happens.
Was it a bill or an EOB?
I mean, the insurance company got the bill, so.
Yeah. And those are things that.
It's not your company. I mean, it's not. I'm not saying you guys did anything wrong. It's just it does happen. Somebody has to pay for it.
So I have a question for someone at the hospital. So if there's a patient that doesn't necessarily need life flight, why are the physicians getting that? Is it because there's not a transfer available?
So typically the reason why we use life flight is the ambulance can't get there in time. The doctor wants them out of there, or because they need actual life flight. So those would be your only reasons.
And like I said, it goes back to medical necessity that the provider at that time has to prove, has to sign off on for us to go. So, and we get those documents. When we fly somebody, they fill out documents and hand them to our flight crew. So that's part of our patient record.
Necessity and patient movement.
Yep.
That's what we're doing now.
So I know lately there's been a couple times where ambulance, like I said, is being paged out twice for 2 different calls. Is the ambulance the one deciding which one is higher priority?
So we have, as far as, we have what's called a determinant. So is there a dispatcher, right?
Yeah.
You can certainly jump in on here, but as the dispatcher answers or asks questions of the caller, they determine the severity of that call. And so if two calls were to come in at one time, and one is what we call an alpha and one is an echo being the most serious, if there was only one ambulance available, we would go to the most severe call first.
So are you putting that liability on the dispatchers to make?
It's our crew's choice. The dispatchers just tell us this is the severity of the calls that are coming in. They don't tell us who goes or which call gets answered. It's us. We make the determination we're going to this call or that call.
And really, it's our program that we use. The questions are preset. We ask them, and then we throw them on I am responding in the call, and they get it, and they're able to look at that. Or we'll tell them on the radio, this subject, has had 3 strokes in the past. Their oxygen's really low, blah, 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 blah. We'll tell them whatever. Or this person, tripped, fell down, might be a dislocated knee. If those calls came, then they make that decision.
I just wanted to make sure the liability was.
It's very similar to like if 2 people present to the emergency department at the same time. Those people are triaged. They're given an ESI number level, and whoever's sicker or more injured gets seen first. Does that make sense?
Yeah, I understand that. I was just clarifying that the liability is not on them, so.
I think the premise of this meeting was to try to determine if we were still getting the same level of care that we did when Roger Heskey was running Newcastle ambulance service at the current subsidy that the citizens are paying. I know that I personally, and I'm sure that other members of the council have been contacted by our constituents with concerns, right? And it's not new. When Roger was getting the subsidy, this is a small town, there was a lot of people that had concerns about him even receiving a subsidy for a privately owned business. This is a service though, right? And it's a service for our community. So I guess we're trying to address what we can do to make the level of service in our community. So I think one of the things that we came up with, right, is better marketing to try to get community buy-in to see if we can get some people on staff with the ambulance and some drivers. So I don't know if anybody else has anything.
I was just hoping.
Oh, yeah, I was gonna say, I think our issue is that backup crew for that second ambulance. That seems to be what I think we would agree on is the issue. One crew is here 24/7, 365 and responds immediately. I think the 2 options we have is the route we were talking about where collectively we work on building up our workforce in this community with people who live and work here so that they can provide that on-call service. If we can't do that, our other option is we would then have to assign more people within our system to this base, which is can I finish this?
What was wrong with the young man from Napa back here that had the idea you get 2 drivers, you divide your EMTs and you've got 2 ambulances covered. You need a part-time driver or 2. That's it. And immediately we can change the problem.
The only issue with that is maintaining that ALS level coverage that's in the contract right now that we have to provide.
So how many of your transfers that you miss out on require an ALS person?
That would be a question for the hospital, but I would say majority of our transfers are ALS levels service. And then also we're not then leaving an ALS provider in the community. And I'm not willing to sacrifice not having an ALS level service.
Could we ask the hospital, do you have any idea as far as a rough percentage on how many of these transfers are because you know we don't have an ambulance right now and you just can't wait the length of time it's going to get here?
So just in March, we had 4 that we had to like flight or private vehicle because of either staffing or
Now,
their matrix.
was that because of severity increasing of anything, sickness or anything, or just because the ambulance couldn't get there at that time?
Because of safety matrix or time. Yeah.
Before anybody else talks, there's like 3 people that have their
Yeah,
hands up.
their idea, our commissioner.
Okay. Gary Huber. As a commissioner, I have to say that you're not building confidence in me about your service. I've heard the same things from people, and the concerns for the people that live here, they're great. I live 12 miles out. That's like city limits almost. If you are 40 or 50 miles out and you're waiting an hour for an ambulance to get here and an hour to get to your house, you know, that's just unacceptable. And I'm really questioning, we got into this agreement with you last year. It's has no teeth. It's just a really nice, we're going to do a service for you and we're gonna let you and we're gonna throw a little money your way. If things keep going like this, I'm gonna want a lot better agreement than that. In the agreement, it says you are going to provide service for Weston County. And in my book, I know everybody's short of staff. That's a problem in the world these days. But you promised us by that agreement you were going to give us that service, and I don't think you followed through with that. I think there's other ways you can look at it. We're trying to help you out. Hey, maybe drivers, maybe get some lower EMTs. Advertise around here. I've never seen any, I didn't even know you were looking for people. But people aren't going to look at Campbell County when they live in Weston County. It's just not going to happen. Look at Weston County, look at Cook County. They're not going to look at your stuff in Campbell County. We're apples and oranges there. But I feel like the staffing, how many ambulances were here when you took over? I'm just curious. 4. How many are here now?
2 to 3.
2 to 3. Here on site all the time. You just don't have anybody in them.
Right.
So how does that crew come from Wright? In an ambulance. With the Wright ambulance. I see some things here that don't make a lot of sense business-wise and logic-wise. As a citizen of the county, you're making me feel like if I'm really sick and need an ambulance, I'm going to drag myself out to the car and have my husband take me.
So,
and that's a really sad thing to say, because we depend on you in a rural community for that first response medical. We depend on it so much, and for us not to be able to depend on it, it's very scary for us.
well, if I can respond, so you wouldn't wait an hour for a 911 response. The issue we're facing is not being able to respond to your 911 call and you having to wait for an hour to respond. We're talking about the unit facility.
That's not true though.
No, it's just, no.
I'm gonna wait half hour
Just let me
if you step out into the ambulance after I call, I'm gonna wait at least a half hour for you to get to my house probably.
Based on your
Because I
location
live
where
in
you
the
live.
country.
Correct. So the other thing that we are doing, that when we first signed this agreement, it was, we are responsible for Newcastle, and then we're responsible for Weston County up to the portions where Upton takes over and Osage takes over. Osage is no longer in business. We now respond to 100% of their calls. Upton is down to 2 people, and we respond to almost 100% of their calls. The county commission still gives the city of Upton $20,000 for an ambulance. They give us $15,000, but yet we're the ones responding and covering that area of the county, which is now placing another burden on the system here in Newcastle. So I would say we have graciously, if you will,
Do you work with the
extended our,
ambulance though?
Yes,
I
we
mean,
do.
we graciously extended our service
Very
area without asking for more money, without saying this is not in the contract.
But that is
because
part of Weston
we-
County. When you said Weston County,
You give them money though,
I think she read it, it says Weston County.
but you give them money separately to provide the service, not
We have a
us.
lot of people money.
I know, but when they
Well, yeah,
can't,
but you-
then we have Okay, to do it. the thing is that the prior service that was here, it's no secret, I always wondered why we were paying a private entity, and I didn't think we should. And now I'd rather pay him for the way he ran his service than Campbell County.
Miss Commissioner, can I answer your question? So you mentioned having to wait, up to an hour because you live out of town. Occasionally, based on location, even our patients in Campbell County or in Sheridan do occasionally, based on where they live, they've assumed the risk upon themselves to not live close to any sort of emergency medical service or a hospital. That's a risk that you've
I
taken upon
understand
yourself.
that, but if I have to wait because an ambulance is coming from right, that's a whole different thing. That's a whole different thing. We don't.
You don't have to wait
But
for.
yeah, our truck in Newcastle, which is responsible for Newcastle, the truck from Wright only comes over to backfill if.
Okay, so there's an accident up on Highway 450 and you're up there. And now my aunt is at my house and she's had a heart attack. Who's coming?
Newcastle.
You got another set of people there ready to come to my house.
We have a couple extra staff that we call in on occasion to help us backfill.
And then
They live here.
Yes, not very many of them.
And where do those people live?
We have a few staff, we have 4 staff that live in Newcastle.
Okay,
4.
there's several people behind you with their hands up, and that gentleman in black.
I know it was a little over a week ago, or maybe just a week ago, that there were 2 911 calls that came in probably 15 minutes apart. One to Mondale Heights, and then another one right behind the ambulance bay. And the lady behind the ambulance bay that fell had to wait until they cleared Mondale Heights, dropped the hospital, and then got to her. So that's not true that if it's a 911, that you've got the staff. I could have a 911 call for me, and Pam could have one for her, and guess what? One of us is waiting because you don't have the staff to do it. And with Roger, we may have waited 10 minutes, but we surely did wait an hour.
Now, like I said, it has nothing to do who is your staff. Your staff that you have is absolutely wonderful. It's just, what are we gonna do to fix this to make sure that our community is taken care of?
So, I just see that the hospital transfers they have to be a priority to you all. I understand 911 is transfers, but the hospital transfers are just as important, and they can be just as detrimental to the people of this county. The hospital is clearly having a problem. The wait times there have increased. There's problems with beds not being available, so there will be residents that have to sit and wait in the waiting room for longer because you can't get a transport out. There's also, I personally have been a person who's sitting in a hospital bed in the emergency room. Yes, I'm in the emergency room and I'm being taken care of, but I need surgery. And that 1 hour that I have to wait to head to the operating room is like 900 hours long. But the hospital, I understand the 911, but the hospital transfers, they have to be a priority as well. And you're gonna have to get the staffing thing
We have one
straightened out.
gentleman waiting to answer or ask a question.
So I just, everything's going down to staffing, and I heard you when you were here a couple months ago, saying you couldn't get staffing and trying. And, so I just Googled EMS classes, Newcastle, Wyoming, and the last classes I found. So I just want to verify that I'm correct. Were in June of 21 or August of 21.
That's probably the last one that Roger put on in Newcastle.
No.
It's advertised Gillette.
I think it was advertised as Campbell County.
Yeah.
It was August of 21.
Yeah.
So it was Campbell County. I went to Facebook and marked and searched EMS, just like you guys said to do. And the last post that came up for Campbell County
looking for help was in August of 21.
So a post for Campbell County looking for help, or a post for an EMT class, I'm sorry. What, are we talking about an EMT class or looking for?
Well, I guess I looked up EMS class in Newcastle, because you said you were advertising classes.
And so as the training supervisor, I can tell you that we've had 6 EMT classes. I can't talk to the marketing aspect of things.
Exactly.
But if, can I stand up?
Yes,
I'm
yes.
sorry. So what we're witnessing is not just here. There's a collapse of rural EMS. All right? You guys are facing the same problems that Moorcroft, Wyoming is facing. You're facing the same problems that, you know, they're having in Buffalo. You're facing the same problems in, you know, places that are shutting down their ambulances because they can't figure out how to fix this problem, right? We've got to figure out a way to throw spaghetti at the wall and have some of that onus on the community to help figure this out. I think it's apparent that the cost to pay the way the ambulance does that to get the service that this sounds like this community wants is too great. And it doesn't match up with the number of calls that as a business, running an ambulance service as a business to stay sustainable, it doesn't make up for that. So I would suggest looking at alternative ways to help supplement the ambulance service. Do you have a volunteer service? Do you start having the drivers? It's a brilliant idea. How do we get it? Let's skin that cat with drivers. There's got to be a way to figure this out. But I think the way to do that is to work together as a team and not be vilified as, you know, the ambulance, it's their fault. This is a problem that's been brewing in not just this community for a long time, with the insurance reimbursement rates dropping, with people having trouble volunteering. 20 years ago, you could volunteer, and if you got a page, you could leave work and go do it. People aren't allowing them to do that
I have a
anymore.
question for you.
Yes, ma'am.
We talked about volunteers and we were told they have to be employed.
So I'm talking about volunteers running a different ambulance. You might be able to have a volunteer person, you know, help out on their own ambulance as a second response. The way that we're set up right now, we can't liability-wise have someone who's not an employee on our truck doing an out-of-town transfer, working on a regular basis.
How did Roger do it?
So
Roger,
I can't
way
speak
for you guys to set up the way Roger did, because he obviously had volunteers and had coverage for those volunteers.
So my
And
understanding-
helped man that. And if we're saying that we need to look at something different, why can Campbell County as a entity not look at mirroring a small guy like Roger across your board and help you out everywhere, not just in Newcastle?
So if I could, so with the way that I understand that Roger ran business is he was able to pull people from the hospital when they were on shift, get them on the ambulance and boogie down the road. But I don't know that you always had a 911 truck. So sometimes that transfer would go out on the road and there wouldn't be potentially a truck until someone else came out.
When I had an ALS patient one time, when, that we needed to transfer from Newcastle, a nurse got in and ran the drip and did everything, and she rode with me in the back of the ambulance.
We have a question.
So I was just gonna say, as working for Rogers Ambulance, how he did it, we were considered paid volunteers. So we were on call. He gave us, if I remember right, it was 10 minutes to get to the bay, no matter where we were in town. So we were on call. In an emergency, rarely we would pull a nurse if needed from the hospital, but there was a primary crew and a backup crew at all times. Sometimes there was third and fourth backups too. If there was a transfer, he would start calling the call list after sending the transfer out to get somebody to come up. So we only got paid if we went on a call, which is not ideal. I mean, it's much better to have.
And it's
get
hard
paid
to
all
do
the
with
time.
our labor, the way that we have to be structured with our stuff, but can I ask, are you still an EMT?
I'm a nurse, nurse practitioner now.
So would you be willing to help out on the ambulance?
I would, and I actually.
Could she take her baby?
I have got 4 kids and bring them on, train them up right, and then there's our future workforce.
So I talked about it when you guys first came here. I think I talked to you about it, but then I went to school and didn't have time.
But you got done with school.
I did.
Do nurse practitioners qualify?
Oh, I'd say they qualify pretty good. The one thing you have to do is get with the state EMS office to ensure that they would be able to work with that level. That's a pretty high level of care. That'd be similar to that of a physician working on a truck.
So is there a way, or who do you guys talk to in Campbell County to kind of do a volunteer thing and?
Like the backup crews never got paid until they went on call. Nobody was.
I mean, is there something like that that someone we could talk to?
So we have an on-call system, and we generally only use it when like these winter weather emergencies come through or there's large events. But within our pay structure, if someone is required to immediately respond to the base or call, we have to pay them an hourly rate, which is only $2 an hour. But that guarantees that you're not gonna go and have a drink at the bar, you're not gonna leave town. It says, I'm paying you to stay here. And then once we activate you, then you get time and a half. So you're immediately on your overtime wage, even though maybe you worked 0 hours this week. That's how our HR department, through Fair Labor Standards Act, all those labor rules and regulations.
Have you advertised that? That sounds like a pretty good deal.
So we have positions posted, and we have for basically nonstop for 2 years. We've had positions posted on under CCH, under EMS, and I have applications constantly coming in. So EMS constantly has applications. All you have to go do is search EMS job Wyoming, and we are one of the first ones to pop up per our marketing. So if you go search EMS job Wyoming, we come up. So if someone wants a job with us, it's pretty easy to find a job with us because we're posted and our postings out there.
Is there a minimum like requirements for how many days you have to work and stuff?
Yes, we have different pools.
I think that's where the problem might be, is the minimum requirements.
The minimum is usually right around 12 hours a month.
24
hours. And that's I guess it's a 6-week period, I don't know.
How long was the EMT class?
6 months.
There's a question in that.
Again, if I get that advertisement from you, I mean, the most obvious place for us to post it would be at the hospital, right?
Yeah.
So, I mean, that's what we've been asking for. We're the medical staff, if you're looking at a volunteer to run whatever. I mean, I think that would be your obvious. You have to.
And I think too that I know some of our EMTs, they go to your other services. Why not leave them in town to cover this area? That way they're available. I know you call them and you know what, they pay, but it's like they're traveling to all your other services to cover those and you're leaving us shorthanded.
So we
When it
have
comes to
had
transfers.
So
or anything.
we have had some EMTs that have worked for us that live in this community that do not work for us any longer. And for whatever reason that is, I can't speak to, but you know, that's.
I think I was speaking to one of our employees that works with us, rotates through the shifts, goes to the different base locations, gets more call volumes and different things and brings that experience back here. You're saying that if they weren't transferred to another base, they would be here available to respond as like a second out? Okay. So the way that we rotate through our shifts, everyone in the Gillette system has to work through Newcastle, they have to work through Wright, and they rotate through. And so even the Newcastle people have to rotate through those areas. And so what that does is it allows people to get more call volume in the Gillette system, but then rotate out to the slower bases like Wright and Newcastle to kind of get a break. But it brings that good level of experience all the way around. And so when you say like one of the employees that works, I won't say their name, but they work 2 days a week. And then whatever they do with the rest of their time, they're in your community, they live here, and we rely upon those folks to call them if we need them, but we can't force them to come in. I can't coerce them to come in.
No, I'm not saying that, but I know that there's at times they're working somewhere else and there is nobody to call.
Or that person's working at the hospital and they can't work on the ambulance to help her call. I mean, it's a problem all across the board, but I agree with you. If we could get more people in this community that have this training, we'd be able to get it figured out.
I think, Linda, one more thing would be, all those employees, they're full-time with us, so we have to get them their 40 hours a week. Well, if the base here is covered, we have to then put them to work to get their minimum of 40 hours a week, so that might be the open shift in Gillette or the open shift in Wright. Instead of just saying, I'm not gonna work you today because this shift is covered, we have to put them to work.
And if you don't mind me speaking to the shortage, it's not just affecting EMS. We at Black Hills Lifeline are affected by it. Hospital, they use travel forces to great costs, even our company. So it's a systematic problem. This is something that has started even before pandemic. It was probably before the pandemic, that healthcare has seen a shortage year after year after year after year. So it is finding the creative solution to do that. Maybe it's also, I don't know, and please, you can throw stones at me, especially the fire department when I ask this. Is there a mutual aid on some of these calls? Does the fire department come to some of these calls or mutual aid? So that's an option that you set up as a state.
They've requested to not be called.
The fire department, we don't have any EMTs.
Okay.
We don't have medical direction.
Okay.
So for us to go do a medical call, we can't do.
Okay, no, and that was just a question. I'm not trying to stir the pot, but but it's definitely a problem that's not just the ambulance. It's universal in healthcare. It's universal in law enforcement. To find good police officers nowadays is very tough. We all know the world that they live in. So it's an overall emergency service, and by saying that, I say all emergency services are facing this problem. Healthcare, EMS, us. So it's finding that creative solution. I know these folks want to do the right thing, and so does the hospital, so do we. So I think finding that solution it can be done. It's just difficult.
What areas do you guys cover?
All of Sheridan County, Campbell County, and Weston County. And then we're to the mutual aid aspect that I talked to. We're routinely responding into Crook County because those services are struggling with staffing. And that's out of our Gillette base down here. Crook County, portions of Converse County, north of Douglas and Bill, we respond down into there. And then we'll do the kind of the very eastern portions of Johnson County, where the Campbell-Johnson County line is along like Highway 387 and that southeast portion of Campbell County.
I would like to speak to, I
Custer Highlands.
know you guys,
And they go down to Mule Creek as well.
yeah, I know you guys talk about 2 ambulances staffed here, and in Campbell County, to compare call volumes and staffing of ambulances, in Campbell County, we staff 2 ambulances in Gillette, 1 ambulance in Wright, and our volumes over there are upwards of 4,000 dispatches a year. Our dispatches over here with 1 ambulance are in the 600s, 672. So for us, 1 ambulance is that's why we have 1 ambulance. We determine the number of ambulances staffing based on our call volume. It's not because we're like, oh, we're just gonna put 1 ambulance there because that's just what we're gonna do. It's truly based on the volume. That's how we make that decision. So
That's how you make that decision for your business, right? But
correct.
But we understand that. But you're here, we called you to this meeting tonight so that we could talk about this issue with our constituents and the people in this county thinking that they're not getting the coverage that they deserve.
And if
So-
you'll let me finish, I'm not done yet.
Okay.
Thank you. To understand how much it costs to be able to have another ambulance is, I ask you to go to this page that we handed out.
Okay, which page is that?
That's this little pamphlet that we handed out to both. In order to have another ambulance staffed here, it's going to be upwards. So 1 ambulance cost per year is $868,000 to be staffed 24/7. That's how much it costs to be able to provide ambulance service. And that's a cost, if you ask an ambulance provider across the nation, how much does it cost to provide EMS service at an ALS level, they're generally gonna say somewhere between $800,000 to $1 million based upon location. And this is the number that, if you look at all of the costs that are broke down for you, that's the number that it costs to staff 1 ALS ambulance. Now, if you look at what it costs to staff 2 ALS ambulances, that's broke down for you, and then 3. This is the why, and I understand what you're saying, I get that. This is why we have not been able to fully staff. Now, integrating and coming up with solutions on how we can figure out, yes, could we possibly do with volunteers, yes, can we do that? All I'm trying to say is there's a cost associated with that. And right now.
What we're saying is there was a guy that was running an ambulance service in this town that was able to get us the coverage that we wanted.
I'm not Roger Hespy.
No.
He's not Roger Hespy. We are not Newcastle Ambulance. We are Campbell County Health EMS.
That was another one of the things that came up too is we were under the impression that you were going to keep the name, and then all of a sudden we got Campbell County Ambulance Service. So, I mean, that's just, maintaining what, we had pride in what we had here, and now the ambulance is parked in a lineup over in Campbell County.
That ambulance has been replaced with a brand new ambulance.
And she can speak to the ambulance.
Just so you're aware, we purchased a brand new ambulance.
What I hear is your company's getting so big from Sheridan all the way down to Converse County that you've got an overhead that you can't take care of your ambulances, and you're running at a loss?
What do you mean? No. I'm running at a $500,000 positive at overall. I'm running at a loss in Weston County. This is the only place I'm running at a loss.
Yeah, but you picked the month of February. Everybody loses money.
I'm just.
Could add.
No, we provided you the entire fiscal year, which included February.
I provided the full fiscal year.
Okay, I just heard February. But we had a question back there.
So what kind of subsidy do you get from Campbell County?
Our budget comes from the hospital in Campbell County.
Okay, so the county and the city of Gillette don't pay you anything extra?
We're a hospital district, so we are a taxing entity. We get tax dollars in that go towards the entire hospital. And then, obviously, through the budgeting process, portions of that come down to the communities.
But, so, my point to that being is, as Weston County, city of Newcastle, from what I've heard earlier, we're paying you $115,000 a year to run this ambulance service. And you say you don't run 2 ambulances because our call volume is lower.
Mm-hmm.
Well, we're paying you though for part of that to staff your people, so you have that.
Do you
So
know
how much more money would you?
yourself?
How much more money would you make if you have the ability to do the transfers versus passing the transfers off to Flight for Life?
So we do transfers. In fact, in 20.
I know, I get you do transfers, but you don't do all of them because you don't always have the staffing to do so. You pass some of those off to Flight for Life because the hospital can't wait for 2 hours for you to get somebody here. So they say, sorry, we can't wait. So they don't need to go Flight for Life. They could go ground, but because you don't have the ability to send them ground, we send them on a flight.
I understand what you're saying, it's a good question. I don't believe that we would make up the revenue of having a second ambulance for a place that gets 600 calls a year in the transfers that we're missing for whatever reason from the hospital.
But, so that's where I guess the community doesn't understand, because Roger was able to do that with 4 ambulances, and we're currently just asking for 2, and you're telling us that it can't be done. I mean, I get that there's more overhead in running a second ambulance, and I see the numbers on this sheet, but you can't tell me that every cost is double. You don't pay for 2 ambulance bays just because you have a second ambulance. You don't pay, you've got to maintain that ambulance whether it leaves the bay or whether it sits there all year long. Yes, there are some additional costs because it's driven, but it still has to be maintained.
You'll notice in this sheet that not every cost is doubled. So when you go from 1 ambulance to 2 to 3, the cost isn't doubling or tripling.
And to your question about the way Roger did things, we can't not pay people. I can't ask someone to sit at home and volunteer their time and then pay them.
I get that.
And especially if there's not people in the community that live here, I can't ask Chris to drive from Gillette to sit in Newcastle on the chance he might get a call and he might get $15 for that call. I can't do it. That's why I think it would be really important to get people that live here into EMT classes
But I also know Roger was willing to employ drivers. Because I personally spoke with Roger 5 months before he sold the service about being just a driver. And told me what times I was available. If he had transfers, he would call me so I could drive while they had an EMT in the back.
I think that could be part of
And
the
that would
solution.
cover. But you guys have now done this for 2.5 years, and why did it take somebody in this meeting bringing that up?
Would you also be willing to hire an EMT?
No.
There's the.
I'm sorry.
Honestly, like, I'm curious, like, you do.
I'm 52 years old. If I go to become an EMT, you cannot pay me what I make right now.
That's what everybody else
That
is saying.
forces
Yep,
me
that's
to
the
say
problem.
I can't do that. Okay, I get that. But
You could work as a
can't
part-time
get anybody
EMT
to
just
work
as well as you
anywhere.
could work as a part-time driver.
I don't do very well with other people's bodily fluids. Can I
That's
drive an
another
ambulance
problem.
and get you from point A to point B? Yeah, but
We have a question.
So, here's the bottom line of staffing, and I want to, I've worked with a lot of the EMTs in the past, and I've worked with Nub, and I've worked with a lot of the other guys, I've worked with Brad. They're all great, and they do a fantastic job. And,
Thank you.
and kudos to that. And the bottom line is the staffing. And however, and I've sat and I've listened to different calls on the radio, and I've seen numerous times. And here's my main concern, and I've talked to the sheriff about this, and I've talked to the county deputies, and I've talked to past officers that were on the PD before, in the past, and they've had the same concern. And I witnessed this with one of the PD officers. There's been calls where one ambulance is out, and then there's another call, and then they have to wait. And sometimes that wait's not very long, and I timed one where it was well over an hour. And my concern is, one of these times it's gonna cost somebody's life. That sometime it's going to be a cardiac arrest, or it's gonna be a major bleed, or it's gonna be something where that ambulance from Wright is gonna be too long. And they're already up on Sweetwater, or they're in Upton, or something, where they're not just at Mondale or something like that, where they can just come and do that. And that's my major concern, and I know it costs money, everything costs money, and it's hard to get staff, and I understand that. I'm more than willing to put flyers up and put it on my Facebook page saying, hey, let's recruit, let's get people. But a lawsuit from somebody who passed away because there wasn't an ambulance there is gonna cost you a lot more money.
I'm sorry, sir.
I have a question really quick. Angie, does the hospital have, or could make a position where there's a driver and someone who can medically transfer a patient?
So we did give them those 4 names for drivers. They're just drivers. But that would be through their service, obviously.
So is the 4 ambulances that were here, are they all being used?
So currently, we did buy 4 ambulances. One of them was replaced with a brand new truck, and we are currently using that in the system. Due to our current staffing model, we only keep 2 trucks here because that's the minimum expectation of, like, okay, so we have 1 911 call out, and if we do have any additional staff in the area, they could be able to come to the base and grab that second out ambulance.
So
Otherwise,
where's the other 2?
what's that?
Where's the other 2?
So we have another truck that they are utilized in the entire system. So, and again, to the other counselor's question about why did we change the colors of the trucks, is that you guys are proud of your service. We too are proud of the service that we provide. That's why we chose to change the branding of the ambulance to reflect that Campbell County Health is providing services in Weston County. So we do have one truck that was replaced. The 2003 had over 310,000 miles on it. We replaced it with a brand new truck, and it's used as needed based on service needs and other things that happen, mechanical breakdowns and such.
Okay, so where is that truck now, the old one?
Old MS 36 is used. We've currently got it in a kind of a mothball situation. During COVID, we upstaffed more so than what we are now due to our perceived higher volumes that we were going to have with COVID. That truck is currently sitting in a parking lot. We are going to have an auction of some ambulances that are no longer needed, and that's going to be included in there.
How about we talk to someone and have one donated to our hospital so they can do transfers? I hear the crickets.
So I don't have the ability to donate an ambulance. You guys would be more than, you guys could bid on it in the auction.
But who could we call?
We'll bid you 100,000.
So,
Probably like $20. I wouldn't, those ambulances are gonna be scrapped for parts.
No kidding.
Right.
But
they are at the end of useful life.
I'd like to speak to that too. The rebranding of the ambulance service here. Like, I thought that was something that was agreed upon, right? That you guys you were gonna keep the original ambulances here, right? Personally, I don't care. I just want ambulances to respond. I don't care if they're pink ambulances or purple ambulances. I just want ambulances getting to the people that need them. So I understand you guys are proud of your service. I think that we made good ground here, right? We need to find, we identified some needs, right? We need to find drivers or EMTs, and then we need to work as a community with your organization to make sure that people know that the classes are out there and that, that there are positions available so that we can fill this gap. Well, the classes are usually up to May, aren't they?
So if I could speak to that, I know you've got a question, sir. So the EMT classes, because of COVID, we've been allowed by the state EMS office to do more distance classes. So it used to be you had to go to the location and sit there 3 nights a week. That's allowed us now to be able to do distance learning. So people can go into Zoom or WebEx or whatever platform, watch that class, and then do their skills, their hands-on skills, in whatever location they're at. And actually the state EMS office is very aware of this problem. They're working on lowering the age of EMTs to 16 to try to get some more people involved. And they're also allowing people to do these distance learning classes. It's a bad problem. And there's people that are training their sheriff's deputies to be EMTs, their city workers to be EMTs. There's all sorts of different ways to skin this cat, but the long and short of it is nobody's willing to put in the time, even with a distance learning class. So if you were to do a distance learning class right now and take Thursday night, every Thursday night you go down to Zoom, you would Zoom into class for 4 hours, and then that week you'd work through the material, and then once or twice a month you would go to whatever location you're at, so Newcastle, Sheridan, Buffalo, Casey, what have you.
To do practicals.
Yeah, to do your practicals. But the problem is people don't want to give up their 4 hours of Thursday night to do it and then get a job that they don't get paid for, or they get paid minimum wage to do. And that's the problem we're running into.
I have a statement from Roger Hespy. Newcastle Ambulance Service always had a 911 truck. So folks, the past is the past, period. So solution need to be found to fix the problems. That should be the focus. Staffing is their issue, so what is the fix? Money to pay EMT paramedics. Again, that does not come from me, that's from Roger.
So legislation this year, the governor just signed a bill into effect that we can form EMS districts. Would that be a solution? That Weston County forms an EMS district That way you can start advertising EMTs within Weston County. It could still be serviced through Campbell County, but Weston County would have skin in the game. Obviously, it would have to go through the county commissioners to be formed, be put on the ballot box, because then you'd have a mill levy similar to the fire district. Could this be a solution?
Absolutely. To your point, we presented that as a possible solution back in February. And we would prefer to continue to be the EMS agency you contract with to provide services in Weston County. I think if you can get it through the voters and you can raise, it then provides a funding mechanism for here. So it's not all on the city or not on the county. Collectively, everyone is paying into this district to help raise the funds to sustain an ambulance. I think it's a long stretch. I don't know if it's going to happen, but that's the issue I think EMS agencies face is not a lot of people are willing to pay for an ambulance service when they're already paying for a fire service and law enforcement and whatnot. It's a tall ask. But the funding mechanism behind it is great. Again, back to Roger's point is this all comes down to staffing. We can put 10 ambulances in the base here and have no one to run. You can give us $1 million this year. We don't have anybody to pay that to. We've got to find the staffing. And it has to be in this community or the surrounding nearby areas. And I think we could probably go on for hours and hours, and I'm willing to do that. For me personally, as the Urgent Emergent Services Director, working closely with Shauna, our philosophy is a partnership. And to our fault, and maybe some to yours in the counties, we haven't even really communicated on a regular basis. It's always sort of contentious and hot and heavy like this. And I think that's affected our relationship to where we're nervous driving over to Newcastle. Oh boy, what are we in the hot seat for tonight? And we have ownership in that. We've done some things to put ourselves in the hot seat, but I've also tried to be very frank and honest with you. We're not turning candidates down and just trying to run this as lean and mean and make as bunch of money as possible. We're really going, where the heck can we find staff to help us out here? Our ideal state is, again, 20 people to help augment our system. And the last point I'll make is I have the utmost respect for Mr. Heskey. We've become close friends through this process. You can imagine the flack that he gives me as the current ambulance administrator versus him. We've had some really good conversations, and I would say Roger did an amazing job managing the ambulance services in this community for the 20-some years that he did. But I think what we're facing now, he was starting to face towards the end of his tenure, in that when we took over, there was 5 people left on the roster. And I don't think it's anything Roger, I know it's nothing Roger did. I know it's just the reality was starting to hit. And I think regardless of who's sitting here today, the same conversations we'll be having of, why can't you staff an extra truck? Why can't you staff an extra truck? We have limits in place that have taken some of the mechanisms away that Roger used, but I think we need to think creatively. We need to think, how can we do this differently? Because our current model is obviously not effective for a second ambulance. I would put our first out ambulance up against any other ambulance service out there. I'm proud of that. But I would agree with you that we have work to do to staff up that second ambulance to bolster our numbers.
So being that the nature of EMS is dealing with death, bodily harm, I mean, it's tied up in emotion too, right? So it gets pretty hot and heavy when we have to have these discussions. But that's the kind of static that we get as being sitting members of this council too, and making sure that our constituents' money is well placed and that they're being provided with the services that they require. So, yeah, I understand I probably got a little bit like hot and heavy there for a second.
I respect that.
We've kind of, I think that we've really kind of figured out the direction to go, right? Yeah, so now we just need to make it happen.
Let's say advertising on paper.
Sorry, somebody didn't make the point of that. I just told you. Oh, I mentioned to Shauna that I would like to propose, I don't know how it would work, but some sort of quarterly meetings that would involve
members of the council, members of the commission, members of the hospital, maybe even emergency management, fire department, but it can be the EMS quarterly workshop. And certainly the initial focus can be how can we all work together to make this happen. But then after that, it can be just a normal, regular check-in of here's where we're at, here's what we're doing. So none of it is blindsides to you guys, because I appreciate you're getting these blindsides by community members. You didn't expect this to happen, and now they're complaining. And I don't want to blindside you with anything. I want to be upfront and honest. I want to develop a good working relationship. That's more than just once a year when we ask for money. We have a relationship that we have built and work on all the time. So that would be my other proposal. Is I'd love to do quarterly EMS workshops.
Without communication, everything breaks down, right? Yeah. I think that's a really good idea.
Is this something that can piggyback or be at the same time that the hospital already has theirs?
With our quarterly meetings with them? Sure.
I would just say, the dates ahead of time, so it'd be nice to get that out.
Yeah, I can send you the next one. You'd probably just have to have our conversation first, right, for patient confidentiality, and then we can, yes.
Does anybody else out there have a question or comment?
I just have seeking from Dublin. He was reading the, I think it was with the county. May I get your input on what you saw there?
In terms of the county's contract with NAS, it's pretty simple. It ends June 30th, I believe. So the commissioners obviously will be deciding whether or not to re-execute that contract. The thing with it is that it's kind of a simple thing, and I think right now in terms of the city not having a written contract, I think that's also a problem as well. I think in terms of whether there's a district set up or something, I think a quarterly meetings is a great idea. The reason for that is just I think this is again a communication thing. But I think the city will also need something similar in writing, but probably a little more specific. So that's all I have to say. Well,
Thank you.
So listening to this most of the night and then getting back feedback from many people and constituents and listening to a few past ambulance calls and issues that's been passed, not having coverage during a 911 call. And you're here asking, going to be asking for money and what your service is actually providing for that 100,000, potentially 110,000. What is your message to this community, to us, on how you're going to improve that, and then come back later, a few months later, and say, hey, okay, this is what we've done, this is what we're doing to improve, this is what we're doing to earn this money, and the county commissioner is saying, oh, okay, now you guys have taken a step. What is your message to bring back to everyone that you're going to provide what you're being paid for?
Well, I was going to say, I feel like we kind of covered that with discussing, working on trying to do the advertising better over here for the classes and the recruitment the best that we can, and better communication with you guys. I can't fix the staffing problem. I can't. That's
So
not
if we have a
something.
quarterly meeting, next quarterly meeting, will the message be the same, that we're not getting anywhere, you're not getting anywhere? Or is there going to be a message in there saying, okay, this is the steps we've taken, we've advertised, we've got 5 people interested, so it's a step in the right direction? Or will we stay in that same line, message to everyone, we're just going to give you this money, and we're going to be status quo?
Well, I
No.
hope that to not be the case. I mean, I would anticipate us.
At the next quarterly meeting, Mr. Stevens and I will commit to you that all of the different mechanisms we've talked about, advertising the city's website, whoever's website, we will have intentional, detailed information that says, here's the steps we have taken to attempt to recruit people, whether it's to work who are already licensed or into our EMT class. We will share all the places we advertise, We will share any numbers of applicants that we have received. So we won't come in and say, sorry, it's the same message. We'll at least be able to tell you, here's what we've done. Might take a month or two to say, here's the results of that.
And that's what I want to see. The bullet points that I see right now, okay, if everyone giving you options to do potential drivers, potential volunteer staff, those are the bullet points that I want to see hit. Come back and say, okay, this is what we've done to these pieces that everyone here has talked to you about. We have not gained ground on it, but oh yeah, okay, now we've got 6 people that's going to be on our driver list. That's a huge step from what we have now, right?
Yep.
But there's step increases to show them some type of an advancement.
Absolutely.
I guess I kind of will piggyback on you is, I don't know who you guys go back to talk to in regards to some of this, but is there, or is it you guys?
So she's my direct boss, so kind of the chain of command is this, and then she reports to the CEO. Shauna did meet with her and the CEO, yeah.
She's very quiet.
She's listening to take that. So is that something you can get back to them about hiring drivers that aren't EMTs?
So, yeah, we have to involve our quality and risk department and a whole bunch of other things. So it takes some conversation on my part. I have had conversations with Ken previously, which hit a roadblock, but we'll try again.
But I do want to reiterate that it's not yours. I mean, we know it's a staffing issue, but it's the staff you have is fantastic. And I haven't heard anything from the calls that they've been on that the service was bad or anything. Yeah, it's just the not having the staff to provide what is needed or wanted.
Okay, so, well, you know me, Pam. I tend to run more emotional than financial and everything. But, you know, we keep asking them, what are you guys going to do to fix the staffing problem? But maybe we should also be asking our community and Newcastle and Upton and this county, what are we going to be doing to fix the staffing? Because Upton, like they said, has 2 people. And these guys are running their butts off, covering Upton, so that the only other really town, I mean Osage also, has coverage, you know, and for somebody who has family in Upton, that makes me very happy that they are going, but we gotta be careful or we're not gonna have these guys either. You know, that's my big fear, that we're not gonna have anything. So, I mean, it really has to be, at this point in the game, symbiotic. You know, as far as can we put stuff on the websites, the city and the county websites and Facebook pages for them? You know, is there, and this is total, probably BS on my part, but can the city or the county help pay for, what do the classes cost? Are there, can we do scholarships?
The Campbell County EMS classes vary. So based on the level, so an EMT level class generally runs about $900 to $1,200. The AEMT level class generally runs about $1,300 to $1,600.
So I would come in and pay $900?
So if I could tell you what's going on for other communities. So other communities are working through the hospital and other companies that do EMT classes, things like that, and getting deals, because there is this huge problem, right? How do we get EMTs set up in these small communities? Can I speak about the grant?
Yeah, absolutely.
Okay, so, I'm sorry, it feels so weird talking. Sorry, I'll do this anyways. So, I'm the training and education supervisor for Campbell County. I train all of our EMTs, all of our paramedics, and we've got over 80 plus staff from Sheridan to here. It's tough to train everyone to the same level, but we try to do that. There are ways to get education out to the communities for discounted prices. So we recently put in for what's called a regionalization grant that was set of ARPA funds, ARPA funds through the state, and Campbell County was awarded $3.7 million. My part of that was, what if I was the FTO or the education officer for all of Northeast Wyoming? What would I want? I got to write my dream list of education stuff. I wrote stuff that I didn't think I'd get, and I got it. So much to my boss's chagrin. So I got discounted EMT rates. I got scholarship money, so that if there's people in this region that want to take an EMT class and promise to serve on their local ambulance, they can get a free or discounted EMT class. I got free education, so that everyone who's an EMT that's serving in their respective communities and can prove that they're serving with a letter from their agency, they get free CMEs. A subscription that usually costs $300 a person, they get. Every single EMT in Northeast Wyoming can get this. We're still waiting to get the money and going through these things, but these are just some of the things that we can try to do to fix this. The state is trying to throw money at it. You know, the feds are trying to throw money at it. They see that this is coming down the pipe. And my hope is by doing these sorts of things, we'll be able to throw the spaghetti on the wall, get people trained up to the EMT level, and eliminate those costs, those things that are stopping them, cost. You know, we also put in money to 10 people to EMT school that can teach EMTs. So how do you teach an EMT class? We put money in for that. So if you have a community, an agency that wants to be able to host their own EMT classes, we've got the money that we can send to them. And so hopefully here in the next few months that'll all come together. Along with that, we've got money for ambulances to train folks with SIMMIN, synthetic cadavers, much to my boss's chagrin that she didn't get her side-by-side she wanted because I got that fancy equipment. But there is stuff in the works. And all I would say to the council and to the community is this is not a Campbell County problem. This is not a thing that's just localized to you guys. It's everywhere. And I could Google search EMS collapse or rural EMS collapse and come up with about 10 different articles from our area talking about Wall, South Dakota, talking about, you know, Osage, Fremont County. This is not a new problem, and you can spend hundreds of thousands of dollars trying to figure it out, but what really comes down to is people wanting to do their community, help with the community. We're running as a business. It's going to cost money to do the things as a business. But if we can get EMTs here that could run a second ambulance or do things like that, it would help what you guys are talking about with these second out calls.
And that's where I really think the city or the county should be helping them. Maybe, and I'm not talking money, but getting the word out. I've always heard that EMT classes are expensive, and I'm not going to take one. Sorry, no, I'm not willing. I work 12 hours in dispatch. I'm not going to.
God bless you, though, for doing that.
Thank you. But, you know, there are a lot of people in this community that don't have jobs. And maybe they think, well, I can't be an EMT because it costs so much money. But maybe if we can get the word out, if we can do something.
That's the first time I've heard that. If you don't have a job, you
Do
won't.
some kind of ad.
Absolutely,
That
absolutely.
can qualify for free.
So we'll talk with our marketing team, we'll put a packet together.
Right,
But once you get the money.
Once we get the money, we will advertise it.
Well, and
Or
then,
city clerk.
but make sure we advertise here too. Make sure that the city and the county's putting it
Well, so
on
our
there.
goal is to, so if I can speak on this, the big reason for this, and it all stems down to this. EMS is not an essential service. When you go to a community, your police department, your fire department is essential. And she said it, we don't have to be here. We can walk away. And I'm not trying to threaten that. We want to be here. You don't have to have an ambulance service here. No one has to be here to respond to a 911. No one has to come in an ambulance to pick up someone who's sick or injured. We don't, because we're not essential. No one has deemed EMS essential. And that's why it's collapsing everywhere. That's why there's no support for it. So at the end of the day, this is why it's failing. We have chosen as a bigger entity in the region to try our best to support the smaller services, the very best that we can, with what we have. That might only be one truck over here, and that might only be one staffed truck at times. But that's what we can offer, because that's what we have to offer at this point. Yes, we will do our best to try to fix that, but that's what we have. So I understand the frustration. It hurts us just as much as it hurts you. We want to go to Upton. We go to Upton, who has 2 people in their community. That community needs to make a decision whether or not they're going to be able to continue to support their EMS service. Moorcroft is making a decision whether or not they can still have an ambulance respond to their people. It's, as Brad said, it's everywhere. So yes, as soon as we have this money, our goal is not to put all of that money and training into Gillette. It's probably majority not even gonna stay in Gillette, to be honest with you. That money, as we designed that grant, is going to Newcastle, to Upton, to Moorcroft, to all of the, to Sundance, to Hewlett. That is exactly why when we were writing that grant, that is what we wrote it for. I know sometimes we seem like we're like the big guys from Campbell County that don't care, and sometimes that's a picture that's painted, but we care very much. And that's exactly what we're trying to do.
So, every time we engage in these talks, right, I appreciate that you guys are here, right, and that we're getting, you know, an ambulance, right? So, whenever we engage in these talks and it seems like things are you know, going kind of rough, it makes me nervous because of some of the stuff that you just said. I mean, it's a huge gamble with people's lives, right?
It is.
And we don't want to see you guys go anywhere, but we just have to answer to our constituents.
I understand that. And I don't want to provide a crappy service. When she just told me she'd rather have Roger Hespy back, that got me right in the guts. I took personal offense to that. Because I take pride in what I do. And I want to be providing the very best for the communities that I serve. So at the end of the day, I want to do better for this community, and I will do what it takes to do that. But also at the end of the day, I'm doing the very best with what I have. We are not essential. We are not given the same amenities as the fire department. We are not given the same amenities as the police department. It's public knowledge what those budgets are. Compare them. They are apples to oranges.
To where you have an EMS district help you to do those, to get the support? In other words, would you recommend that Weston County and Newcastle and Upton, that we all set up this district? Would you recommend that to us?
I would recommend it. I think that having that financial support for the entire county would be a significant benefit to the residents of the county.
That's what I was gonna say. If you, I think a very calculated and deliberate design of an EMS district would be beneficial. And the limited work that I've done on it for this county is I think you need an EMS district for the entire county, not one for Newcastle, not one.
I agree.
Because we need to support services in the entire county. Yep.
Not just Newcastle. And I don't think it needs to be just for Campbell County Health. Like, we need to recognize, again, like, we're running all the calls in Upton right now. We have to support that system somehow. I talked to the EMS manager in Upton, and we had a wonderful conversation. We work very well together. She said to me, like, I can't have you go away. Like, if you guys go away, I don't know what we'll do. And I, pleaded with me, please don't leave. If, we didn't know why we were coming to this meeting today. I had no idea what the conversation was on. And so she just literally said, please, if it doesn't go well, please don't leave. She just pleaded with me. And literally I said, we're not going anywhere. We're not going to leave anybody high and dry ever. I would never be able to do that. But that was a conversation. That's a desperation that they're in as well. And we want to be able to still provide the service to the entire county. That's what we do. I didn't get into this field to make money. I don't do this to make money. Yes, I run a business, but that's not why I do this. We're not in EMS because of that.
I have a question. Have you asked the county for more money?
Yes. I sent a letter on April 3rd, I believe. We did request a $15,000 increase on that. So I did request $30,000 versus the $15,000. So we did ask for an increase from then. I have not heard anything back.
And I know we have commissioners in the room, and the reason behind that was when we first started this, we were told, essentially, you get $15,000 for your portion of Weston County, Upton gets it, and Osage gets it. Our thought was that Osage is closed, and we're responding to that area, we would like to have their $15,000 stipend. We're not asking for something to be taken away from Upton, because I think $20,000 is kind of their lifeblood right now. So please don't touch Upton.
Yeah.
But we would gladly take Osages that they used to get, just to help bolster our ability to do the things we've talked about tonight.
I was just wondering if the county, I don't know, you commissioners, if you've decided on, I believe you should up yours if we're being asked to up ours. And like what?
The counties would be budget neutral essentially, because they just give us Osages. Yours would be an increase.
The director of operations.
Yeah, so I don't know if you guys have recently seen an article that got put out by the Sheridan paper about a community in similar size to you guys in Northeast Wyoming. Buffalo receives, 4 similarly sized community. They receive a subsidy of around $860,000. So, and not to poo-poo or not appreciate the money that you guys.
They're almost. They're about double our population, or quite double, but
If I may, they've got a healthcare district there in Johnson County that seems to work really, really well. And so they've been very friendly with the Moorcroft town. They were very friendly with the Moorcroft town, and I'm sure they would share anything that you have. So the town of KC, if you were to ask them about their rural healthcare district, they would be able to potentially help guide this conversation. And the last thing I'll say is I'm trying to get into the school system to get credit for the students to take EMT class. And then I've already got them college credit, but I need the school board support to get into those things. And I'm working on that right now in Crook County. But there's a lot of support from the state EMS office for that as well. Because in these smaller communities, sometimes the most folks that you've got are your young population that is in the community.
That's right. That'd be wonderful.
When do you intend, are you gonna work in our school system soon?
I would love to. So right now, I'm working on the Crook County school system, and I'm trying to get into, it's like a pilot type deal, but if we can get it figured out with the Crook County school system, then we could mirror that in other places.
But that's the level EWC outreach here in Newcastle as well.
And the students would get college credit from Casper College for their paramedic program. So there's hope, but we got to be creative with it, and we're trying to do those things. What got us here is not going to get us there. So we got to change it up.
I just want to thank you guys for coming, because I don't think, there is this, not a hostility, but you kind of walk into the room and go, what are we going to say? And I don't think we meant to ever, all of us, whether it's county, city, or any of that, to do that. We've got people we've got to answer to, and we just needed some questions answered.
I agree with you, Ms. McCauley, or
Yeah,
McCauley. One of our norms that we recognize in EMS is that good teams have good fights.
Yeah.
And it's like a family, right? Sometimes you go at each other's throat, other times you love each other. And I want to say, I think you are a great team as a council. The commission is a great team as a council. And I think we're just entering this foray as another part of the team. And what we have done tonight in previous meetings, they might be considered fights, they might even be considered good fights, but this is how progress is made. This is how we get things productive.
Back in the day, my father-in-law had the ambulance service here
Yes, he did.
forever.
I know your daughter very well.
Yeah. And it was a money-losing thing then. He said, I lose money all the time. So, I understand when that's your business, you've got to.
If you don't mind me just dovetailing what Shauna said about essential service. State of South Dakota EMS is also not an essential service. So you as representatives of your communities need to reach out to your state legislators.
Absolutely.
And make these, we are currently through our ambulance association in South Dakota, they're working very hard on changing that statute. It is an important thing. It would help in funding, it would help in retirement. So people want to stay in these careers to do that. And then I'll also go on record in support of these folks. If there's anything that Black Hills Lifeline can do to help you guys, we will promote their EMT classes on our Facebook page. We get people from all over the country that like it. So whatever you guys need, we're more than happy. We're brothers and sisters in all of this. We all are. So we're willing to support that and support your community however we can.
I would like to say before we end this, that what I've heard tonight that you have a grant for something like $3,900,000, and you're gonna share some of that with the other counties and cities around. That was beautiful to hear that you have grants for people to take EMC classes. That just, you know, you got a fan now, kid.
Well, it's high praise. So I guess what I would say is I do wear the Campbell County uniform, but like all of these folks here, we do want to have EMS be something that's successful. And I think that this place has been a really good place to work for, and they do want to do what's right for the community. And the fact that there is that money to go out and do those things, it's what we need. And I think it's gonna be good. But
Do you have a business card? Can I have it?
I'll make sure you get it. I can't give him my actual business card. I gotta give him this one.
I want the lifeline, guys.
I have a limited number, but
I do have one, kind of some stats I wanted to go over, for. We have two commissioners in the room right now. Since, you guys took over in June 2021, Newcastle itself, just Newcastle, not the whole county, has had 743 calls. For the county, not including the Newcastle calls, you guys have had 605. Just so you're aware that it's pretty close when you guys are doing your budget. That's in favor of you guys.
I give you percentages.
I get that.
It's clicking.
So, but once again, you know, it's the service that's provided by the team is fantastic. And, you know, we legally can't just put a Campbell County ad on our city website. But any of us who have a personal Facebook page can post it. So, and we can hang it places. So if you want to email that out, we can try to help in any way that we can, but we just can't put the ad on.
And if our marketing folks are here, they may have said that at the beginning of the conversation. I just didn't know that.
Yeah.
So
We're
2
not
years
the
ago or
marketing
whatever.
experts.
We can talk to substance, just not the logos.
But,
So Newcastle, what's happening for rants and raves? I mean, like, there's some Facebook pages that cover our community. So I mean, if you're marketing, people are looking for a place to post. That's where everybody is asking for jobs right now. You
but
know?
I definitely think if there's quarterly meetings, if transparency would be very helpful on both ends. But thank you very much for traveling all the way out here. Unfortunately, since you guys are the faces, you're going to get all the, it's not.
That's why we're here.
Yeah, it's not you, it's
We get it.
everything.
We like your service, we just want more of it.
Thank you. Thank you very much for coming. Anybody else have anything else before we adjourn?
I move we adjourn.
Well, thank you very much. We are ending at 7:10.
Thank you.
Thank you. Drive safe.